Every 40 seconds, someone in the US has a heart attack, and for many, there were warning signs weeks or even months before it happened. The scary part, these signs are so subtle that most people brush them off as just getting older or being tired. But here's the truth. Your arteries might be quietly clogging right now, and your body is trying to tell you if you know what to look for. And that's exactly what I'm about to show you. In this video, I'm breaking down the 7 silent signs your arteries might be blocked, plus what you should do right now if you notice even one of them. These aren't the obvious heart attack symptoms you've heard 1,000 times. In fact, one of them, number 6, shows up in a place you'd never expect, but catching it early could literally save your life. I'll also share the simple tests your doctor can run to detect a blockage before it becomes an emergency. By the end of this video, you'll know exactly what to watch for and the next steps to take. Heart disease is still the #1 cause of death worldwide, and blocked arteries, what doctors call atherosclerosis, are often to blame. Here's the tricky part. These blockages build up slowly over years as fatty deposits called plaque stick to your artery walls. At first, blood can still squeeze through, so you feel nothing. But as the gap narrows, oxygen and nutrients can't reach your heart, brain, or legs as easily. That's when the subtle warning signs start to show up. And if you ignore them, that's when you risk a heart attack, a stroke, or serious circulation problems. Think of it like a clogged kitchen pipe. You don't notice anything until the water slows down or stops. Your arteries work the same way. The difference is there's no plumber for your heart. You've got to catch the problem before it bursts. All right, let's break down the 7 silent signs your arteries might be blocked and what to do next. Sign 1, unexplained fatigue. We all feel tired from time to time, but fatigue from blocked arteries is different. When plaque builds up, it restricts blood flow. That means less oxygen rich blood reaches your muscles and organs. And just like a car running low on fuel, your body starts slowing down even during activities that used to feel easy. You might notice you're wiped out after simple tasks, carrying groceries, taking a short walk, or even standing for a while. And here's the key difference. This tiredness doesn't really improve with rest. Imagine your heart is a delivery driver and oxygen is the package. If the roads are blocked, it doesn't matter how many breaks the driver takes, those packages still arrive late. That's exactly what's happening in your body when fatigue is a sign of poor circulation. Of course, fatigue can come from many causes: stress, poor sleep, vitamin deficiencies. But if you're noticing new or worsening tiredness, especially along with other signs we'll talk about, it's worth getting your heart checked. Sign 2, shortness of breath. Another subtle warning sign of blocked arteries is shortness of breath, feeling winded, doing things that never used to bother you. Here's why it happens. When arteries leading to the heart are narrowed, your heart has to work much harder to pump blood. That means your lungs and heart are both under extra pressure. Oxygen delivery drops, and suddenly even a slow walk, talking on the phone, or bending down to pick something up leaves you gasping. This isn't the same as being out of shape. Shortness of breath from circulation problems often comes on gradually, and it can happen even if you're sitting still or lying down. Think of it like this: your heart is the pump, your lungs are the filter, and your arteries are the pipes. If the pipes are clogged, the pump strains, the filter works overtime, and the whole system struggles to keep up. If you're finding yourself breathless without a clear reason, especially if it's paired with fatigue or chest discomfort, don't ignore it. That's your body waving a red flag. Sign 3, erectile dysfunction, men. For men, one of the earliest signs of blocked arteries can actually show up far from the heart: erectile dysfunction, or ED. Here's why. The arteries supplying blood to the penis are much smaller than the ones feeding your heart. If plaque is building up in your circulatory system, these smaller arteries tend to narrow first. That means ED can sometimes appear years before more obvious heart symptoms. Researchers have found that men with ongoing ED, especially if it's not linked to stress, medications, or hormone changes, are more likely to develop heart disease later on. In some cases, it's the very first red flag. Think of it as your body's early warning system. If the small pipes are clogging, there's a good chance the main pipes are starting to narrow too. Now, ED can have many causes, and it doesn't always mean heart trouble. But if it's persistent and new for you, particularly if you're over 40, it's worth having both your hormone levels and your cardiovascular health checked. Leg pain or numbness while walking. If you notice leg pain, cramping, or numbness when you walk and it eases when you stop to rest, it could be more than just muscle fatigue. This is a classic sign of something called peripheral artery disease, or PHAD. It happens when the arteries in your legs become narrowed by plaque, just like the arteries to your heart. When you're walking, your leg muscles demand more oxygen. If the blood flow is restricted, those muscles quickly become starved, causing pain or tingling. The telltale pattern? You start walking, pain or heaviness sets in after a short distance, you stop for a minute, and the discomfort fades, only to return once you start moving again. Think of it like a garden hose with a kink in it. Turn the water on full blast, and the flow is still weak. Your muscles are the flowers. They're not getting enough water, so they wilt fast. Leg pain can be caused by arthritis, nerve issues, or injuries, but when it happens repeatedly during activity and improves with rest, it's worth asking your doctor about circulation tests like an ankle brachial index. That simple, non invasive test can compare blood pressure in your ankles and arms to spot blockages. Sign 5: jaw, neck, or shoulder discomfort. When we think of heart problems, we imagine chest pain, but here's the twist. Blocked arteries can sometimes show up as discomfort in your jaw, neck, or shoulders, especially in women. This happens because the nerves that carry pain signals from the heart also connect to these areas. Your brain can get confused about where the pain is coming from, a phenomenon called referred pain. So instead of feeling pressure in your chest, you might notice a dull ache in your jaw, a tightness in your neck, or soreness in one or both shoulders. The tricky part is these sensations can come and go, and they're often brushed off as muscle strain, bad posture, or even dental problems. But if the discomfort appears suddenly, happens during physical activity or stress, and eases with rest, it's a clue your heart might be involved. Imagine a fire alarm in your house. It's supposed to warn you about smoke in the kitchen, but sometimes it goes off in the hallway instead. The danger is still real, even if the signal isn't where you expect it. If you notice unexplained pain in these areas, especially alongside fatigue, shortness of breath, or dizziness, it's time to get it checked out immediately. Sign 6: slow healing wounds on feet or legs. A small cut or blister on your foot or leg should normally start healing within a few days. But if your wounds take weeks or even months to heal, it could be a sign your circulation isn't what it should be. Here's the reason: your blood carries oxygen, nutrients, and immune cells to help repair damaged skin. If your arteries are narrowed by plaque, less blood reaches those areas, especially the farthest points from your heart, like your feet and lower legs. Without enough supply, the healing process slows down dramatically. You might also notice that the skin on your feet feels cooler than usual, or that hair in the area has stopped growing. Both are clues that circulation is reduced. Think of it like trying to water a plant with a pinched garden hose. You can trickle some water through, but it's nowhere near enough to keep the plant healthy. Slow healing wounds can also be linked to diabetes, infections, or skin conditions. But when they're paired with other symptoms like leg pain, numbness, or cold feet, it's worth asking your doctor about a vascular exam to check for peripheral artery disease. Sign 7: dizziness or lightheadedness. Feeling dizzy or lightheaded now and then isn't unusual. Maybe you stood up too quickly or skipped a meal. But if it happens often, and especially if it comes with other symptoms we've talked about, it could be a sign your brain isn't getting enough oxygen rich blood. Blocked arteries can reduce blood flow to the brain in two ways: by narrowing the vessels that feed it, or uh, by forcing your heart to pump less effectively. Either way, less oxygen reaches those brain cells, and you start to feel unsteady, foggy, or like the room is tilting. Some people describe it as needing to catch themselves when they stand up, or feeling like they might faint after light activity. In more serious cases, it can signal a temporary drop in brain blood supply, what doctors call a transient ischemic attack or mini stroke. Think of your brain as a high performance computer. It needs constant, stable power to run smoothly. If the power flickers, even for a moment, everything slows or glitches. Persistent dizziness, especially if paired with vision changes, weakness, or trouble speaking, should be treated as urgent. That's your cue to call for medical help immediately. All right, let's quickly run through those 7 silent signs so they stick in your mind. 1. Unexplained fatigue. 2. Shortness of breath. 3. Erectile dysfunction in men. 4. Leg pain or numbness while walking. 5. Jaw, neck, or shoulder discomfort. 6. Slow healing wounds on feet or legs. 7. Dizziness or lightheadedness. Remember, any one of these could be caused by something else. But when they show up together or happen frequently, your body might be waving a red flag about blocked arteries. And here's the thing, by the time symptoms are obvious, artery narrowing can already be advanced. That's why noticing them early and acting early can literally be the difference between prevention and a major medical event. Okay, if one or more of those signs sounded familiar, here's exactly what to do next. Book an appointment with your primary care doctor and tell them which symptoms you've had and for how long. Ask for basic tests first: a lipid panel and blood sugar, A1C, an ECG, and possibly a stress test if symptoms happen with activity. If you have leg pain, request an ankle brachial index. For people with unclear risk, a coronary calcium scan or CT angiogram may be useful. Your doctor will advise what's right for you. Don't start low dose aspirin on your own. That decision needs a doctor. And if you get sudden chest pain, fainting, or severe shortness of breath, call 911 immediately. If this video helped you spot warning signs you didn't know about, please share it. It could literally save someone's life. Drop a comment if you've had any of these symptoms before and what happened next. Your story might help someone else take action. And remember, this video is for education only, not a diagnosis. Only a healthcare professional can confirm what's going on and guide your treatment. If you have sudden chest pain, trouble breathing, fainting, or stroke-like symptoms, call 911 right now. Don't wait. Minutes matter. Now that you know the signs, the next step is protecting your arteries. In my next video, I'll share 10 everyday foods that research shows can help keep your arteries healthy and blood flowing freely. Click here to watch it.